Two, nursing care of patients with hypertension. You guys might feel this is a definite area that you have lots of experience in. You have treated and seen lots of patients with hypertension. You have administered lots of hypertensive medications. So you should be familiar with these learning outcomes that are outlined for you on page 361. There are 9 of them only. Make sure you review and do your key terms. Okay, hypertension is a risk factor for cardiovascular disease and or a stroke. Again, being that cardiovascular disease is the #1 killer, this is why we see so much hypertension, because it's a risk factor, and it goes kind of hand in hand with cardiovascular disease. Okay, so hypertension, high prevalence, normal blood pressure. We know that the parameters for adults are 120 systolic and 80 for diastolic. So screening, you need to have a normal blood pressure within the ranges of 120/80 for 3 to 5 years. If you're over the age of 39, of course, there's an increased risk. Pressure exerted by blood on walls of blood vessels. That's what the actual textbook definition of blood pressure is. So make sure that if you are needing to do patient teaching, that you understand that it is the pressure exerted by the blood on the walls of the blood vessels. Okay, it's determined by the cardiac output. So if a person has a lot of cardiovascular disease, low cardiac output, right, their pressure is going to be affected. Peripheral vascular resistance, vessel stretch, blood viscosity, and blood volume. We have a couple types here that are identified as primary or essential hypertension, and then we have secondary. These are on the bottom of 362, highlighted for you here. Chronic elevation of systolic and or diastolic is primary. Secondary is known, like if you're having a crisis, such as a kidney abnormality or an adrenal tumor or something that is causing, and your blood pressure will be high, that would be a secondary hypertension. So elevated blood pressure is due to the other condition, another comorbidity. So usually the blood pressure does return to normal, but maybe just during that crisis you will have hypertension. So that would be known as secondary hypertension. Primary hypertension is just on its own, right? That you have high blood pressure above the normal range. There are no signs and symptoms often. You can get headaches, bloody noses, anxiety, or dyspnea, but often people just cruise around with high blood pressure of 220/110 or something like that, and they can have a stroke. They, have really, those are generalized headache, bloody nose, anxiety. Those can be for a number of things. So it is a silent killer. Risk factors are how we diagnose, the doctor diagnoses, signs and symptoms, if any, kidney and heart disease, current medications, okay, all these deals here, factors. Okay, what are non-modifiable and what are modifiable changes? We've discussed this before. Things that you can change and things that you have no ability to change, like your race, your sex, your genetics, like what you inherited, the things you can change, lifestyle, your diet, your stress levels, those types of things. So that's what all of these are reviewing here. These are the medications that are given: nitrile drug therapy, thiazide-like diuretics, angio-converting enzymes, ACE inhibitors, angiotensin II receptors, and calcium channel blockers. Diuretics, ACE inhibitors, calcium channel blockers. Okay, so those are continuing on. complications of hypertension, atherosclerosis, right? Arterial coronary artery disease, MIs, heart attack, heart failures, strokes, kidney or eye damage. Okay. So on page 365 in your textbook, on table 22.3, I'd like to make sure that you see this table and review it. These are medication and classes of various medications to treat hypertension. You are familiar with several of these, but just review these. They're very important for you to be familiarized with these. Okay. Severe blood pressure elevation without target organ dysfunction, progression, severe headache, nosebleeds, shortness of breath, and severe anxiety. Treatment implemented. Okay. Hypertensive emergency, it's higher than 180. For your systolic, your diastolic is higher than 120. Risk for progression or target organ dysfunction. Immediate gradual reduction is necessary. They will give you IV nipride. These are some nursing diagnosis options. You want to focus on lifelong blood pressure control. This is a definite, absolute need for a lifestyle change. If not, it's just putting like a Band-Aid on a, giant hemorrhage, because if you don't change your lifestyle, the blood pressure will not get under control. You might be having mini strokes, and then it will lead to a massive stroke. Eventually, a heart attack. Teaching dizziness may increase the risk of falling. Risk slowly to prevent orthostatic hypotension. Here are some review questions for you.